Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an endocrinologist talking to a patient called Miss Theodora. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Dora. I've reviewed the notes from your GP, but I'd like to hear about what's been going on directly from you. Can you tell me more about what's brought you here today?
Good morning, Doctor. Sure. I've noticed this swelling in my neck for a while now. It's been getting bigger over the past few months, and it's starting to make me self-conscious. At first, I thought it was just weight gain, but it feels firm and kind of strange when I touch it.
I see. Has the swelling caused you any other issues, like pain or difficulty swallowing or breathing?
No, not exactly. It doesn't hurt, but it does feel uncomfortable sometimes, like there's some pressure in my throat. Swallowing isn't painful, but it feels awkward, like something's in the way. And I've noticed my voice gets hoarse more often than it used to.
That's helpful to know. Have you noticed any changes in how you feel overall? For example, changes in your energy levels, mood, or weight?
Oh, yes. I've been feeling so tired lately, like I just can't get enough rest. I also feel jittery and anxious sometimes, even when nothing's really wrong. And my weight has been all over the place. Some weeks I lose a few pounds without trying, and then I gain it right back. It's really frustrating.
Those symptoms could be related to your thyroid function. The swelling in your neck could be due to a goiter, which is an enlargement of the thyroid gland. Have you noticed any changes in your appetite or how you handle temperature, feeling too hot or too cold?
Oh, definitely. I'm always hungry these days, but I don't seem to gain much weight from it. And as for temperature, I used to be the one who was always cold, but now I'm constantly sweating, even when everyone else seems fine.
That's very insightful, Miss Dora. Now, tell me a bit about your medical history. Have you ever had thyroid problems before, or any conditions that run in your family?
Not that I know of. My mom had some sort of thyroid problem when she was younger, but she never talked about it much. And I've never had any issues with my thyroid before this.
And your general health otherwise? Any recent illnesses or major stressors in your life?
I've had a few colds here and there, but nothing serious. I do have a pretty stressful job as a financial analyst, so that might not be helping.
Stress can sometimes exacerbate symptoms, but let's focus on what we can address. Now, have you had any tests done already? Your GP mentioned some blood work.
Yes, they ran some blood tests, and my GP mentioned something about my TSH levels being off. She said they were lower than normal, but she didn't go into much detail.
That's a good starting point. Low TSH levels could indicate hyperthyroidism, which aligns with some of the symptoms you're describing. To get a clearer picture, I'm going to recommend a few more tests.
More tests? Like what?
First, we'll do a thyroid function test to measure your T hormone levels. This will tell us more about how your thyroid is working. I'll also order a thyroid ultrasound to get a detailed look at the gland and check for any nodules or abnormalities. Depending on those results, we may also need to do a radioactive iodine uptake scan. It sounds intimidating, but it's a painless way to assess how your thyroid processes iodine.
Okay, I guess that makes sense. Will I need any treatment soon?
That will depend on the test results. If we confirm hyperthyroidism, treatment options could include medication to control hormone production, radioactive iodine therapy, or, in some cases, surgery if the goiter is large enough to cause significant pressure symptoms.
Surgery? Is that common?
It's not the first-line option, but it's considered if the goiter is very large or if it's compressing your windpipe or other structures in the neck. We'd only go down that route if it were necessary for your comfort and health.
I see. Will these treatments help with the swelling in my neck?
Yes, they should. For most patients, treatment of the underlying thyroid condition reduces the size of the goiter. In some cases, if the goiter doesn't shrink completely, other measures may be needed, but we'll cross that bridge if we come to it.
Okay, that's a relief. I just want to feel like myself again.
And that's exactly what we'll work toward. Let's get those tests scheduled so we can start making a plan. In the meantime, if you notice any new symptoms, like worsening pressure in your throat or difficulty breathing, please don't hesitate to call.
Will do. Thank you so much, Doctor.
You're welcome, Miss Dora. We'll get to the bottom of this together.
Extract 2. Questions 13 to 24. You hear an oncologist talking to a patient called Mr. Hayes. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Hayes. It's nice to meet you. I've had a chance to review your medical history briefly, but to get a more comprehensive understanding. Could you tell me a little more about your symptoms and when they started?
Good morning, Doctor. Well, it started about 4 months ago with a cough that wouldn't go away. I thought it was just a cold or maybe allergies, but it didn't improve. Then I began noticing some chest pain, especially when I took deep breaths. And recently, I've been feeling short of breath more often.
I see. Did you notice any other changes, like weight loss, fatigue, or any unusual symptoms?
Yes, actually. Over the past couple of months, I've lost about 15 pounds without trying, and I've been feeling more tired than usual. I also started coughing up blood occasionally, which is what finally made me go to my GP.
That was absolutely the right decision. Your GP's referral included a chest X-ray and CT scan report, which show a mass in your lung. We also received the results of your biopsy, which confirm that it's lung cancer. I know this can be overwhelming to hear. How are you feeling about all this?
Honestly, I'm still processing it. I've smoked for years, so I can't say I'm surprised, but it's still a shock.
That's completely understandable, Mr. Hayes. Many patients feel this way when they're first diagnosed. If you don't mind, I'd like to ask a few more questions to get a clearer picture. Do you still smoke or have you quit?
I stopped about 3 months ago, around the time the cough got really bad.
That's a great step forward. Quitting smoking can make a significant difference, even after a diagnosis. Now let's discuss the type of lung cancer you have. The biopsy revealed that this is non-small cell lung cancer, or NSCLC, which is the more common type. It appears to be localized to the lung at this stage, but we'll need to run some additional tests to confirm whether it has spread to other parts of your body.
What kind of tests are we talking about?
We'll likely do a PET scan to look for any spread of cancer to other tissues, as well as some blood tests. Depending on the results, we might also recommend a brain MRI because, in some cases, lung cancer can spread to the brain. This will help us determine the stage of the cancer, which is crucial for planning treatment.
I see. And what are my treatment options?
Treatment depends on the stage and your overall health. Since the cancer appears localized for now, surgery to remove the affected portion of your lung could be an option. This would likely be followed by chemotherapy to eliminate any remaining cancer cells.
Surgery sounds serious. How much of the lung would they remove?
It depends on the size and location of the tumor. Sometimes we can remove just a small portion called a wedge resection. In other cases, a lobectomy which removes one of the lung's lobes may be necessary. Your surgical team will explain everything in detail once we have all the necessary information.
And if it's spread?
If the cancer has spread, surgery might not be possible. In that case, we'd look at other treatments like chemotherapy, radiation therapy, or newer options like immunotherapy or targeted therapy. These can be very effective in managing the disease, even at more advanced stages.
I've heard of immunotherapy. How does that work?
Immunotherapy boosts your body's immune system to recognize and attack cancer cells. It's not suitable for every case, but if tests show that your cancer has certain markers, it could be an excellent option.
That's reassuring to know. What about side effects?
Each treatment has its own side effects, which we'd discuss in detail before starting. For example, chemotherapy can cause fatigue, nausea, and hair loss, while immunotherapy might lead to immune-related side effects like inflammation. The important thing is that we'll monitor you closely and provide support to manage any issues that arise.
That's good to hear. What's the next step?
The next step is staging the cancer through the tests I mentioned earlier. Once we have the full picture, we'll meet again to discuss the results and finalize your treatment plan. In the meantime, I'd encourage you to stay as active as possible, eat well, and let us know if you experience any new or worsening symptoms.
All right. Thank you, Doctor.
You're welcome, Mr. Hayes. Remember, we're here to support you through this every step of the way. Do you have any other questions or concerns for now?
Not at the moment. I'll wait for the test results.
That's fine. We'll schedule your tests right away and be in touch soon. Take care, Mr. Hayes.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a presentation about tools used to assess pressure injury risk. Now read the question.
Thank you all for being here. Today, we're discussing tools that help healthcare professionals assess the risk of pressure injuries, also known as bed sores. After evaluating various methods, the hospital has decided to implement 2 of the most widely recognized tools, the Braden scale and the Norton scale. These scales evaluate factors such as mobility, sensory perception, and moisture to determine a patient's risk level. While other scales exist, these 2 are the most validated and widely used in clinical settings. What makes these tools particularly valuable is their ability to help staff tailor preventive strategies to each patient. For instance, a patient with limited mobility or increased skin moisture may require additional interventions, such as repositioning schedules or specialized mattresses. This personalized approach not only improves patient care but also reduces the overall incidence of pressure injuries.
Now look at question 26. You hear a healthcare manager talking to a nurse about issues faced by staff in the hospital. Now read the question.
That's true. It feels like we're constantly covering for others, and it's hard to balance everything.
I understand. And burnout is a major concern we're addressing too. We're looking at ways to provide more support and ensure breaks are prioritized.
That's good to hear. But I just worry about how long we can sustain this without more staff coming in. Do you think we'll get additional hires soon?
We're actively working on recruitment, but it may take time. For now, the focus is on easing the workload and offering wellness programs to help with stress management.
Now look at question 27. You hear a patient asking a neurologist about an unusual condition they are experiencing. Now read the question.
So, for the past few weeks, I've noticed that my left hand has been doing things on its own. It's like it has a mind of its own. The other day, I was holding a cup, and suddenly my hand let go without me wanting it to.
That does sound concerning. What you're describing aligns with a rare neurological condition called alien hand syndrome. This happens when certain areas of the brain, like the corpus callosum, are affected, causing the hand to act involuntarily.
Oh, I see. Is there a way to control it or stop it from happening?
While there's no permanent cure, therapy focusing on awareness and distraction techniques can help manage the movements. But we'll need to run some tests to confirm the diagnosis and understand the severity.
Now look at question 28. You hear a pharmacist talking to a patient about medication safety. Now read the question.
Hello, Mrs. Collins. Before you head home, I wanted to talk to you about something important, medication safety. We've noticed that some medications look alike or have similar names, which can sometimes cause mix-ups.
Really? That sounds a bit worrying.
Yes, it's something we take very seriously. To help with this, we've created a guide that explains common look-alike and sound-alike medications, and it includes tips on how you can prevent errors. For instance, double-checking labels, storing medicines separately, and asking questions if something seems unclear.
That's good to know.
Absolutely. This guide is designed to help you stay informed and avoid any potential risks. Feel free to ask me or any of the pharmacy team if you have questions while using your medications at home.
Thanks. I'll definitely go through it when I get home. Now look at question 29. You hear two colleagues discussing each other. Now read the question.
So, what did you think about the patient safety training session we attended last Thursday?
I thought it was fairly comprehensive, but I felt a few areas could have been expanded on. For instance, I really appreciated the section on reporting near-miss incidents. It's such a crucial topic, and it was explained very well.
Absolutely, that part was really useful. What about the segment on handling patient identification errors?
Well, I found it pretty basic overall, though I can see how it might be valuable for some of the newer staff members who may not have faced those situations yet.
That's a good point. I hadn't considered that, but now that you mention it, I can see how it could be helpful for them.
Now look at question 30. You hear two healthcare professionals discussing strategies for motivating patients. Now, read the question.
Our diabetic patients are following their treatment plans regularly, despite our consistent advice.
Half compliance is concerning, especially for managing chronic conditions. What have we tried so far?
We've already sent them reminders through the patient portal and even called some of them to discuss the importance of compliance.
And those haven't been effective enough.
Not entirely. I think we need to discuss this in the patient support group meeting next week to address their concerns collectively.
That's a good idea. When is the meeting scheduled?
Thursday afternoon. Most of them are expected to attend since we've coordinated it to fit their schedules.
But what about those who don't show up?
For anyone who misses the meeting, I'll arrange individual consultations to go over their challenges and find solutions together.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on use of ultrasound in the emergency department. You now have 90 seconds to read questions.
Hello everyone and welcome to today's training session. We will be discussing the use of ultrasound in the emergency department, specifically for patients presenting with severe or unexplained abdominal pain. This session is tailored for trainee A and E physicians, as you are often the first point of contact for these patients and are responsible for deciding whether further diagnostic imaging, such as ultrasound, is needed. Effective use of ultrasound can significantly enhance diagnostic accuracy and expedite appropriate treatment, leading to better patient outcomes. The focus of today's presentation is on assessing abdominal pain and recognizing when ultrasound is the most suitable imaging tool. Ultrasound is highly effective in evaluating several acute conditions, such as appendicitis, gallstones, and abdominal aortic aneurysm AAA. These conditions, if left untreated, can lead to serious complications. Let's begin by discussing when an ultrasound should be performed. Not all abdominal pain requires immediate imaging. However, ultrasound is strongly recommended if the patient presents with localized pain and tenderness, especially in the right lower or upper quadrant, which may indicate appendicitis or gallstones. It is also necessary if the patient exhibits systemic signs such as fever, rapid heart rate, or a drop in blood pressure, as these may indicate an underlying infection or rupture requiring urgent attention. Additionally, in patients over 50 presenting with abdominal pain and a pulsating mass in the abdomen, ultrasound is essential to rule out or confirm a AAA. Now, let's talk about the key steps in conducting and interpreting an abdominal ultrasound. First, the physician should begin by scanning the right upper quadrant to assess the gallbladder and bile ducts. Gallstones appear as hyperechoic structures with posterior acoustic shadowing. Thickening of the gallbladder wall may indicate cholecystitis, an inflammation that often occurs with gallstones. Next, move to the right lower quadrant to examine the appendix. In cases of appendicitis, the appendix may appear as a non-compressible tubular structure with a diameter greater than 6 mm. Free fluid in this area may indicate rupture or perforation. When scanning the abdominal aorta, focus on detecting aneurysmal dilation, defined as a diameter greater than 3 cm. If a AAA is suspected, measurements should be taken in both longitudinal and transverse views. Aneurysms larger than 5.5 cm, or those with evidence of rupture, require immediate surgical intervention.
While ultrasound is a valuable diagnostic tool, it's important to remember its limitations. For example, excessive intestinal gas or obesity may obscure the view, necessitating alternative imaging like CT. In these cases, clinical judgment is key in deciding the next steps. Another limitation is operator dependency. The accuracy of an ultrasound can vary based on the skill and experience of the person performing it. Consistent practice and understanding of anatomy are essential to improve diagnostic accuracy. Furthermore, it is important to correlate ultrasound findings with the clinical picture. Imaging results should support, not replace, clinical evaluation. Finally, let's consider some symptoms that would warrant urgent ultrasound imaging. These include severe localized abdominal pain, unexplained fever with abdominal tenderness, or symptoms suggestive of vascular compromise, such as sudden onset pain with a pulsating mass. Recognizing these signs promptly can be life-saving. Ultrasound is a cornerstone in emergency medicine for evaluating abdominal pain. It is non-invasive, portable, and provides real-time imaging, making it highly suitable for the emergency department. However, its utility depends on selecting the right cases and interpreting the findings accurately. We'll now open the floor for questions and discussion. Thank you. Extract 2, questions 37 to 42. You hear a conversation between a journalist and Dr. Kelvin Joseph discussing respiratory syncytial virus. Now, read the questions. You now have 90 seconds to read questions. Welcome, everyone. Today we are discussing a breakthrough in managing a serious health threat, respiratory syncytial virus or RSV. Joining us is Dr. Kelvin Joseph, a leading immunologist working on the rollout of the RSV vaccines.
Thanks for having me.
Dr. Joseph, could you start by explaining why RSV is such a concern, especially for older adults?
Certainly. RSV is a common virus that causes infections of the lungs and respiratory tract. While it often results in mild cold-like symptoms, it can be much more serious for infants and older adults, especially those with underlying conditions. For older adults, RSV is a significant cause of pneumonia and hospitalizations during the winter months.
And this year marked a release of RSV vaccines. Could you tell us more about that development?
Absolutely. Two RSV vaccines were approved for use in older adults, which is a major milestone. These vaccines are designed to prevent severe disease rather than stop the virus entirely. Their goal is to reduce hospitalizations and the associated complications, improving quality of life for those most at risk.
Could you walk us through a case study to help illustrate the impact of RSV and the role of the vaccine?
Of course. I'll discuss a typical case based on patients we've seen. Mr. Anderson, a year-old retired teacher with COPD, was hospitalized last winter with severe RSV-induced pneumonia. He had difficulty breathing, and his oxygen levels dropped significantly. After recovering, his primary care team recommended he receive the RSV vaccine to prevent recurrence.
What makes older adults like Mr. Anderson particularly vulnerable to RSV?
There are a few reasons. First, the immune system weakens with age, making it harder to fight infections. Second, many older adults have chronic conditions like heart disease or COPD, which can worsen the effects of RSV. Social factors, like living alone or being in long-term care facilities, can also increase exposure and delay treatment.
So what role does the vaccine play in protecting older adults?
The vaccine trains the immune system to recognize RSV, so it can respond more effectively if exposed to the virus. For Mr. Anderson, this meant his immune system was better prepared, reducing the chances of severe disease. In clinical trials, the vaccines showed over 80% effectiveness in preventing severe outcomes among older adults.
That's impressive. What challenges have you encountered in rolling out the vaccine?
One major challenge is awareness. Many people, including some healthcare providers, are not familiar with RSV or the availability of a vaccine. Another issue is accessibility, ensuring that older adults, especially those in rural or underserved areas, can easily get vaccinated.
How are these challenges being addressed?
Education campaigns are a key strategy, targeting both the public and healthcare professionals. We're also working with community health organizations to offer mobile vaccination clinics and provide the vaccine at no cost for eligible individuals.
What results have you seen so far?
The results are promising. In the case of Mr. Anderson, he received the vaccine before this year's RSV season. While he did catch a mild respiratory infection, it did not escalate into severe disease, and he avoided hospitalization. Similar outcomes have been reported in many other cases, showing the vaccine's effectiveness in reducing severe illness.
What's next in the fight against RSV?
We're continuing to monitor the vaccine's long-term effectiveness and safety. Research is also underway to develop a universal RSV vaccine that would protect people of all ages. Additionally, we're focusing on improving public health measures, like better diagnostics and antiviral treatments.
Dr. Joseph, thank you for sharing these insights.
My pleasure.
That is the end of Part C. You now have 2 minutes to check your answers.